I'm Dr. Miller.
And I'm Dr. Wander, and today we want to talk about scoliosis, okay? And most people have heard that term. So if you're looking at this spine, it should be straight from top to bottom, okay? So this is the person's where their head would be, and they would be looking at you. What scoliosis is, a lateral or a sideways curve in the spine. It could be here, it can be here, it can be here. Some people have multiple ones. And basically a person gets scoliosis because their body is not compensating properly. So with scoliosis, you have to treat it very carefully. There's a lot of different methods done with chiropractic, with physical therapy, with special exercise, with proprioceptive exercises, which that just means where does your body think it is in space and time, and to help it compensate properly. We have digital x-ray in the office, so we'll always take a pre and post x-ray. And Doc, maybe you can go a little bit on what a normal value is, because a lot of people always ask us, you know, is that bad? Is that good? And what we always like to do is we like to give them a number. Like instead of saying it's cold outside, we like to say, well, it's 22 degrees outside. So Doc, why don't you give them a little bit of information on the actual numbers?
So when you're looking at somebody from the side, they should have almost like a reverse C-shaped curve. So it should be a curve that's supporting their spine, and that curve should be 45 degrees. In the lower back, it's also going to be a certain C shape, and that should be 35 degrees. Now also, if you're looking at your discs, these spaces in between the bones, that cushion, those should all be the same or even, and there should be no jagged edges on any of these bones. So we actually look at all of that on your x-rays to determine how exactly this needs to be helped. And we've got a lot of different methods in our course of spinal rehab and therapy.
And we will take pre and post x-rays. In other words, you'll get a first x-ray. We'll determine angles. We'll see, do you have a 20-degree angle? Do you have a 30-degree angle? Are your hips unleveled by 4 millimeters, 6 millimeters, 1 millimeter? Are they level? And then after a course of care, or actually during a course of care, we'll measure it again. And so then we can say, you know, hey, you were 16 degrees and now you're 12. You had a 5-degree difference, 5 millimeter difference in your hips, and now you have a 1. So we're going to quantitatively measure that throughout the program so we have objective data. So anyway, if you or someone you know is suffering from scoliosis, give us a call. Our office is in Rockville. We serve patients in Gaithersburg, Bethesda, Washington, D.C., Northern Virginia, Silver Spring, Kensington, the whole metropolitan area, and we'd be glad to help you.